up to the 20 week. It is formed by the endothelium and blood vessels of the fetal capillaries, then extraembryonic mesoderm, then basement, then the cytotrophoblast, and then syncytiotrophoblast. And during late pregnancy, the fetal capillaries has come on the periphery. So the fetal and maternal blood are separated only by the endothelium and the basement membrane of the fetal capillaries and thin layer of the syncytiotrophoblast. So placental barrier has been thinned out during late pregnancy. And circulation of blood through placenta, bloods flow in the lacunar spaces at the 9th day of pregnancy, and this shows the first sign of establishment of feto-maternal circulation. So in the lacunar spaces, the blood of the spiral arteries is coming, and the spiral veins, they will lead to exchange the blood of the lacunar spaces is coming and going out by the spiral veins and coming through the spiral arteries. So this lacunar space, which will form the intervillous space, is filled with maternal blood, and the fetal blood, it is coming via the umbilical blood vessels, or the fetal blood vessels are formed, it is coming from the fetus. So and the amount of blood in the intervillous space is 150 ml, and per minute blood flow is 500 ml. So we can say every minute 3 to 4 times blood is replacing, or we can say every 15 to 20 seconds this blood is replaced, because per minute 500 ml per minute blood is coming, and this volume of this space is only 150 ml. So intervillous space, which is the lacunar space filled with maternal blood, and chorionic villi is filled with fetal blood. Now the classification of placenta in the human being, according to the shape, in human placenta, it is circular or discoid shape. So discoidal placenta. Sometimes there is abnormal placenta. In this, two lobes or two discs are there, then it is called as bilobed or bidiscoidal placenta. If there are multiple lobes are there, multiple lobules are there, then it is called as multilobular placenta. If it is diffuse or just like a membrane, then it is called as membranous or the diffuse placenta. And sometimes a small part of the placenta is attached to the main placenta, then it is called as placenta succenturiata. And sometimes there is a hole in the placenta, then it is called as placenta fenestrata. And sometimes this placenta peripheral part is covered by a layer of the fold of decidua, then it is called as circumvallate placenta. So according to shape, it is bidiscoidal, multilobular, diffuse, placenta succenturiata, where the small part is separated from the main part, fenestrata, in which hole is there in the disc, or circumvallate part, placenta, in which the circular fold of decidua is covering the peripheral part of the placenta, then it is called as circumvallate placenta. Then anomalies of the placenta according to attachment of the umbilical cord. Normally the placenta, the umbilical cord is attached in the central part in the human being, and if it is attached to the marginal part of the placenta, then it is called as marginal placenta or the Battledore placenta. Then if the umbilical blood vessels, usually after entering into the into the placenta, then they divide, but sometimes the umbilical blood vessels divide before reaching into the placenta. Here in this diagram you can see the umbilical blood vessels has been divided before reaching the placenta, then it is called as furcate placenta. And if the umbilical cord is attached to the amnion, which is covering the fetal surface of the placenta, then it is called as filamentous placenta. And in this condition, umbilical blood vessels has been divided before reaching the placenta. So this is filamentous placenta. So according to attachment, marginal placenta or the battledore placenta when it is attached to the periphery, furcate placenta when the umbilical blood vessels has been divided before reaching the placenta, or the filamentous placenta where the blood vessels are attached to the amnion of the placenta. Umbilical cord is attached to the amnion of the placenta and blood vessels has been divided or before reaching the placenta, then it is called as filamentous placenta. Here you can see the normal placenta, that is central. This is the paracentral placenta in which it is umbilical cord is paracentral in position. This is marginal placenta and this is the placenta in which umbilical cord is attached to the amnion and blood vessels has been divided before reaching the placenta. So it is called as filamentous placenta. Now according to distribution of the umbilical blood vessels, first is the dispersed type in which the blood vessels show dichotomous branching, means they are dividing after entering into the placenta and they decreases size progressively, decrease in size progressively, so that is called as dichotomous branching. So this is dispersed type, that is normal in human being. And then second diagram you can see that is the magistral type. In this the arteries are showing the uniform diameter, there is no decrease in size of the arteries near the periphery, so that is the magistral type. And the last one is the furcate type in which the blood vessels has been divided before entering into the placenta. So this is the type of placenta according to distribution of umbilical arteries. Now phylogenetic classification, in which one is the epitheliochorial. Here the placental barrier is formed by the maternal tissue is the uterine epithelium here in this diagram and the fetal tissue is chorion. So this epitheliochorial type of placenta is present in the pigs. Then comes the epitheliochorial type of placenta, which is the bovine placenta present in cows, and then third is the hemochorial placenta, which is present in the human being. Because in human being this is the maternal blood and this is the fetal blood in the capillaries. Fetal blood in capillaries and maternal blood are separated by chorion. So this is the hemochorial type of placenta in human being. And hemoendothelial placenta where the blood between the maternal blood and the fetal blood there is endothelium of the blood vessels. So according to phylogenetic classification, then there is epitheliochorial, endotheliochorial, then hemochorial, then hemoendotheliochorial and endotheliochorial type of placenta. So that's all about placenta. Thank you.